stock price declined sharply last January when the company had to acknowledge to investors that it had paid more claims, meaning provided more health care to Americans. So the fact that they revealed that they had provided just a little too much health care, their stock price went down. That's the capitalist healthcare Hunger Games we're living in. Hey, it's Jordan. I am in Flint, Michigan, East Palestine, Ohio, Tumwa, Iowa. Please support the only independent outlet on the ground covering what the corporate media covers up. Jordan with Status Coup. As the case against Luigi Mangione, the alleged shooter of UnitedHealthcare CEO Brian Thompson, is delayed now until mid-February, there will be no delay in UnitedHealth showing its profits for the last 3 months of 2024, profits that are expected to hover over $6 billion for that final 3 months of 2024. Let me give you some of the details here. On Thursday, it will be the first time UnitedHealth executives led by CEO Andrew Whitty will speak publicly since December 4th, when the company was slated to hold its investor day, which was canceled in the wake of the shooting in New York. When UnitedHealth releases its fourth quarter and full year 2024 financial results on Thursday, the report will almost certainly include a profit, despite rising medical costs for seniors insured by its Medicare Advantage plans and expenses most UnitedHealthcare and Optum businesses endured from one of the nation's largest cyber attacks on a U.S. company. And that's in reference to the cyber attack that happened last year against UnitedHealth, which I believe they say cost them over $2 billion in revenue. But Wall Street analysts are bracing for the continued impact of rising medical costs on UnitedHealthcare, like the health insurance industry more broadly, and insurers like UnitedHealth that have Medicare Advantage businesses. Just disgusting, the term businesses for healthcare. Medical care costs are up. UnitedHealthcare has more than 50 million medical care plan customers, including 7.8 million people in its Medicare Advantage, which we have reported extensively on, has basically been a whole big bucket of fraud perpetrated on elders and seniors by UnitedHealth. Third quarter net income, so that would be those months were July, August, and September of 2024. Third quarter net income, i.e. profit, was over $6 billion for UnitedHealth. Analysts estimate that the fourth quarter, so October, November, December, will be an average of $6.72 per share, which would be up more than 9% compared to the fourth quarter of 2023. So in English, folks, UnitedHealth on Thursday, by my math, is expected to reveal that they made over $6 billion in profit for the final 3 months of 2024. Most of that profit off the backs of scamming seniors, scamming all of us through their deployment of artificial intelligence, which, as has been reported, has a 90% error rate, upwards of a 90% error rate in terms of denying claims that should be approved. And other fraudulent schemes that UnitedHealth has been engineering. That's a whole lot of money, even though, according to analysts, healthcare costs are up across the board. I wonder how much money they would make if they actually approved the claims that should be approved, which, based on whistleblowers we've spoken to, they had strict instructions to deny as many claims as possible. And they even had quotas for how many claims they had to deny. I want to show you this. This is from Wendell Potter. He is a former executive in the healthcare industry, the for-profit healthcare industry. He is now a whistleblower, has gone on cable news extensively talking about the predatory practices when he was a vice president at a major healthcare company. But this is his piece, From Darlings to Prey, Wall Street alligators snap at big insurance. And he talks about how UnitedHealth, among all the predatory for-profit health insurance companies, has done the best or lost the least amount of money. 2024 was a tough year for big insurance on Wall Street as plummeting stock prices and rising investor scrutiny put health insurers in the crosshairs. Big health insurance companies used to be Wall Street darlings, but that changed dramatically in 2024. So much so that you can now count investors among a growing list of influential folks who are beginning to question the value proposition of those behemoths. Big insurance is now up to its neck in alligators, and investors are arguably the biggest and most existentially threatening alligator of all. You can be sure Wall Street's current view of health insurers is far more troubling to industry executives than the scrutiny the companies are now getting from lawmakers, regulators, class action attorneys, the media, and their own customers. I'm not sure that scrutiny is actually going to be carried out and anything's going to actually change for them, but we'll see. That's because as insurers' stock prices decline, so does the executive's personal net worth. Speaking of the health insurance executives, the lion's share of their compensation is paid in the form of stock options and grants. As the piece goes on, he goes into how in 2024, a lot of the major health insurance companies lost money or revenue. Overall, 2024 was a very good year for investors. As the Washington Post reported last week, the stock market soared despite Americans' widespread discontent with the economy. But for individuals and institutions that own stock in any of the 7 New York Stock Exchange health insurance conglomerates, 2024 was a very bad year. In fact, in all my years in the industry and as an industry observer, I have never seen so much market capitalization, more than $100 billion, vanish in a single year. So he goes through a lot of the big insurance companies and how much they lost. Humana, Elevance, Centene, Cigna, which is the health insurance company he used to be a VP at. But one company didn't do as bad. The company that fared the least worst was UnitedHealth Group. Shocking. Its shares were down just 4.74% for the year. UnitedHealth stock price declined sharply last January when the company had to acknowledge to investors that it had paid more claims during the last 3 months of 23 than Wall Street had expected. Just read that sentence. Their stock price declined sharply last January when the company had to acknowledge to investors that it had paid more claims, meaning provided more health care to Americans. So the fact that they revealed that they had provided just a little too much health care, their stock price went down. That's the capitalist healthcare Hunger Games we're living in, where the value of your company goes down the more you actually provide health care, which is supposed to be the stated purpose of your company. Their stock price declined sharply last January when the company had to acknowledge to investors that it had paid more claims during the last 3 months of 2023 than Wall Street had expected, but it recovered in subsequent months and reached a high of $630 on November 11th. But over the following 7 weeks, UnitedHealth shares dropped 20%. Clearly, investors have become concerned that the days of getting handsome returns on their investments in these companies might be over, as both Republicans and Democrats in Congress and state legislatures, as well as federal and state regulators and attorney generals, have taken aim at insurers' Medicare Advantage and pharmacy benefit manager business practices, which we at Healthcare Uncovered, that's the name of his Substack, have reported over the past 2 years. We will see next week when UnitedHealth, the biggest of the investor-owned insurers, announces its fourth quarter and full year 2024 earnings, if Wall Street thinks the industry can turn the ship around or decides it's likely a Titanic, of course, because Wall Street runs the whole country, i.e. we live in the United Corporations of America. In terms of UnitedHealthcare and the earnings they report on Thursday, investors will be looking for evidence that the company has figured out how to return to profitable growth, and specifically, if it pulled enough levers during the final quarter of 2024 to reduce the percentage of revenue it paid out in medical claims. Oh my God. Health insurers consider it a loss when they pay a claim, hence the term medical loss ratio. Again, investors, i.e. Wall Street, will be seeing if UnitedHealthcare, when it reports its earnings, can show that it has figured out how to deny enough claims, i.e., kill enough of you or shorten enough of your lifespans, enough to provide Wall Street investors enough bang for their buck. And this is a democracy we're living in? No, this is a freaking hellscape. This is 1984 Orwellian dystopia. This is the healthcare Hunger Games, when the value of your company or investors' definition of whether to invest in you is how many claims did you deny? Are you exemplifying that you've figured out the sweet spot for how little or how few people to actually care for, approve claims? I mean, it's just vile. And of course, this angle or this dynamic is not talked about in the New York Times. It's not really talked about on panels on CNN. Not even talked about really that much on independent podcasts. I want to play for you a clip from an interview I did over the weekend with Steve Zeltzer. He is the head of the United Front Committee for a Labor Party. His group is actually putting on a protest later today in San Francisco outside the massive JP Morgan Healthcare Conference, where UnitedHealth, Aetna, Cigna, all the big boys, and Wall Street vultures are going to be there. We talked about Wall Street's insidious role in this predatory for-profit health care industry. Let's take a listen.
The takeover of healthcare from beginning to end is controlled by Wall Street. They're making determinations. The so-called nonprofits like Kaiser, HMOs, are also profiteering. Their executives make millions of dollars, and they also deny healthcare, or they limit healthcare. Doctors don't want to practice anymore. Doctors and nurses are leaving. The stress of being a healthcare worker in this privatized system. You can only spend a limited time with a patient. You really can't take care of patients and do your job. It's driving healthcare professionals away from the profession that they've spent their lives doing. And that is a terrible thing. You spend your life trying to be a professional healthcare person, and then you can't do your job. This is a systemic contradiction, really. It has to be resolved politically by working people fighting to have a party, actually, that says we're going to get the insurance companies, privatizers out of healthcare. And that means fighting the not only the healthcare companies, JP Morgan, but the Democrats and Republicans who represent these banks and billionaires. Yep. And that's what we face.
I think it's Wall Street, folks. Follow the money. You cannot have this predatory system, which has been legalized and normalized, without the Wall Street vultures and, frankly, crimes that are illegal in other countries being normalized and legalized here. A little bit more, by the way, this healthcare conference will be today, January 13th. At 4 o'clock Pacific is the protest outside this healthcare conference. Let's see how JP Morgan puts it. Their healthcare conference, and they describe it as the premier conference, is the largest and most informative healthcare investment symposium in the industry, which connects global industry leaders, emerging fast growth companies, innovative technology creators, and members of the, quote, investment community. So that protest will be at 4 o'clock Pacific outside this health insurance industry. Interestingly enough, the names of the executives, even the identity of the companies that will be there, not been disclosed to the public. I wonder why. Of course, we're not advocating for any violence, but if you have this big conference, why do these companies not want to raise their hand and say, yeah, we'll be there? Maybe because you're all getting together and celebrating and brainstorming further ways to screw the American people and kill us for profit. Maybe that's why. I wonder also if the shareholders of UnitedHealth, who reportedly want an explanation into these claim denials, I wonder if they're going to speak up at this conference. You know, in the past, we've seen Amazon shareholders, feign outrage and, pretend to care about the workplace exploitation, the unsafe conditions, and then really not follow through with pulling their money or anything like that. According to reports, UnitedHealth shareholders demand a review of policies that delayed or denied healthcare access. Shareholders are calling on the company's board of directors to release a report on how its policy of limiting or delaying access to healthcare may be impacting the company's brand and the economy overall. But the best part of this, oh my God, in supporting statement, the shareholders said United Health Group's policies that cause, quote, delayed or avoided medical care threaten both the company's brand name as well as its investors' portfolio by, quote, increasing consumer debt, jeopardizing health of policyholders, and thereby reducing the workforce productivity, straining government resources, and risking increased taxes. So the shareholders, their main issue, it seems, is not the immoral denial of health care to people who need it. It's not shortening people's lives or outright killing people. It's, hey, you're going to reduce the workforce because too many people are going to die or get sick, therefore hurting the economy, straining government resources, or risking tax increases on us, the shareholders. What kind of warped, sicko mindset has captured the American zeitgeist? Well, not the whole American zeitgeist, apparently just the shareholders of for-profit vultures like UnitedHealth, who seem to want a report and an explanation on these claim denials, not to actually help patients and Americans, but not to hurt the economy or risk tax increases on them. Can't make it up. Cannot make it up. We will cover any news related to the protests outside the JP Morgan conference. Hopefully get you some video there that will, I think, circulate from other groups. Also, we are on the ground currently in North Carolina covering the ongoing disaster and aftermath of Hurricane Helene, where many, many people are still displaced, who have lost their homes and have nowhere to go in the frigid winter cold. Please, please support our independent and on-the-ground reporting as a Status Coup member. Sign up for as low as $5 a month. StatusCoup.com/join.